I got involved in palliative care because as a physician I look after very, very ill patients. Patients with kidney failure, heart failure, lung failure, and in fact majority, 10% to 15% of the medical admissions end up dying in the hospital. So I was actually really concerned about what are we doing for these patients who were dying in the hospital. And the other question was, did they really need to die in the hospital? Because the hospital was now being seen by the community as that place where people go to die. When we initially, Lindy van Niekerk was my intern, and she came up with the concept of starting a palliative care service in the hospital. After we did our training, it took about 6 weeks, we then started doing a pilot study. So that was the starting point, and we saw these 10 patients over a period of 4 weeks, and we evaluated what the patient's experience was like and what the family's experience was like, and everybody enjoyed it. Everybody just loved the fact that you could talk about what was wrong with them, gave them more time for the patients. The families were involved in the discussion, and from the data we had from that pilot study, we realized, palliative care is actually very important.
I had started having problems with, I couldn't eat, and I was losing weight at a rate of knots, which had always been a dream of mine to lose weight, but this was a little bit beyond ridiculous. And they discovered that my liver was so, what they felt, totally beyond repair. There was just no function left to the liver, and it was a scenario where they called in my family and advised the family to call in the priest and say, you know, this is the end for me. I'm not going to recover after this. I've got roughly about 3 months to live. So now to move forward, when I passed that first 3 months, and then I passed the next 6 months, I decided to start living. Since then, I've slowly been getting my health back together, and I need to start exercising more because I need to get my legs going. But I mean, after having been in a wheelchair for 6 months, I'm still quite happy the fact that I can at least walk, and I'm starting to put my life together again. And
my husband he had what they call emphysema, and at the time we didn't know what it was about, and Auntie so-and-so had emphysema, so it's not a big deal until we were called in. But then we spent so much time at the trauma unit at Victoria Hospital, it was becoming our second home already. By then we had already known that he was terminally ill. So what do you do now? Most people would just go, give up. You are dying and the family is all around you and this and that. But then when we got to abundant life, we realized that we were not the only people going through that. And that is where we got your support, and that is where I learned to actually, then I was my husband's carer, but then I learned what to do for him, when to do it and how to do it, and with the result we spent so much less time at the hospital, because we have decided to live in abundance. We live one day at a time, and that is what abundant life is all about, because they were there supporting myself, my children, and then when he passed, I had my family. We were married 52 years. To lose your partner after 52 years was terrible for me. But I had my abundant life family around me. I didn't need grief counseling or anything. And I'm still with him. And the saddest part for me is there's so many people out there that need to be on the program.
Did this intervention actually impact on the hospital? And what we found was that we immediately decreased the number of return visits of these patients, and that the majority of the patients actually didn't want to die in hospital. They actually wanted to die at home. So that then made us realize that we as a hospital don't need to be the place where people come to die, but that we should be a place where we provide care for people, and patients should get a choice as to where they'd like to be when they die.
So one would ask, what does emergency medicine got to do with palliative care? Medicine is a journey. So from the acute phase till you end your life, it's a journey that doctors now and then take part in. Obviously, as an emergency specialist or as an emergency care provider, my job is to save lives. But saving a life doesn't always mean literally saving a life. It's sometimes just to provide comfort and care to the patient, which is sometimes very difficult in a noisy, crazy environment that we call an emergency department or a casualty. So where palliative care has changed the way we practice is a sort of a go-to place for the patients to go. So from where their family would be concerned and phone an ambulance and send a patient to an emergency department, which not necessarily we're going to be able to cure the patient, now they've got a contact to actually to phone instead of maybe coming with an ambulance, just they've got a concern and that can be addressed. So from an emergency department, it's changed that unnecessary admissions or brought into the EC for the family and the patient itself, because it's uncomfortable to go from a bed at home and come lie on a trolley in a busy, noisy emergency department when it's the last space of your journey on earth. Alright, so first of all, it obviously decreased the workload in the emergency department. The second thing, which I think is much more positive, is for the guys working in the emergency department, when they find a client that we see, well, we cannot cure them anymore, but at least we can care for them. And it has made a difference.